My name is Doug Speake. I'm a consultant colorectal surgeon at the Western General Hospital in Edinburgh, NHS Lothian, and I'm an NHS Research Scotland clinician. We are delighted to be the first centre in the UK to be using the Versius robot. We think it's a tremendous opportunity for the organisation, but also for our patients. And we're also looking forward to the larger community, particularly in colorectal surgery, where we can collaborate with other centres as they come online with their robotic programmes. There are a multitude of benefits for a robotic program, and specifically to Versius and collaborating with CMR, because that's what it's been. We've collaborated with them to optimise the use of the robot for colorectal surgery. So some of the benefits have been innovation, portability. There are publications demonstrating perhaps that there are advantages for specifically rectal cancer. We are yet to factually prove this, I think, but what we have found is that as a busy unit where we do a lot of open surgery, a lot of laparoscopic surgery, some of the perhaps concerns were, would we be able to use this new device easily for laparoscopic surgery? And we started with sensible cases such as a right hemicolectomy, anterior resections, and we broke them down into parts, and we were thinking we would only get to the very first parts, and we found with the first case and the second and third cases that we were able to perform the operations in their entirety. I think the minimally invasive surgery has benefits to patients. I think that laparoscopic surgery, minimizing wounds, many would argue it would decrease their length of stay, but it's not entirely about length of stay. I think there are limitations with laparoscopic surgery. I think robotic surgery is the next step, and now that we've tried it, there's no way of going back from there. And the benefits for the patient, but actually for us as surgeons, is the view. People talk about precision. It's not just that. We have precision with the robot. We have 3D monitors. But we have a lot of precision with the instruments we're using, but it's also the view that we get. So having not done any robotic surgery, working deep in the pelvis, having that unrivaled view, having the precision allows us to perform operations that you can't do with straight instruments. It's the wristing. And that means that we don't make larger incisions, that we can actually more efficiently progress an operation with the device, arguably. I think patients would see more timely recoveries from their operations. Our view also is, because the way that the Versius, specifically the bedside unit, set up, that there is absolutely no shear on the patient's abdominal wall. So it's not just about an incision. We don't know this yet, but we think that they don't have as much pain in their abdominal walls. They aren't therefore in as much pain post-operatively. So the quality of their recovery, anecdotally, is better. Our ability to perform the operations in a very comfortable manner without necessarily struggling as much as we might perhaps laparoscopically, and certainly converting to open, comes with its own set of wound problems, arguably incisional hernias. And if we can decrease the chances of that happening and perform an operation with a clear view, with precision, that's better for the patient, but actually it's also better for us because we're not prolonging the operation for all those involved.